Solidarity forever.
Katiba Institute, the Union of Kenya Civil Servants, Kenya Medical Association, Kenya Union of Clinical Officers, Kenya National Union of Nurses, among other stakeholders, today joined the Kenya Medical Practitioners and Dentist Union KMPDU to challenge the enactment of the Social Health Insurance Act 2023 in court.
If it requires demonstrations and if it requires national strikes, we will proceed because we cannot renegade on the benefits that we have achieved in our collective bargaining agreements.
This is a law that tries to completely centralize health, which is a devolved function, because primary health care is primarily offered by county government. The government has no business taking taxpayers' money to a fund.
According to the unions, their list of recommendations and concerns were not heard, an indication of a privatization scheme that could pave way for corruption.
The bill comes out and says that the regulations should be made by the boards. The boards have already been constituted, but the regulations have already been made. And we will see another aspect of public manipulation next week, whereby they'll be asking for views when they've already made the decision to the same.
Despite paying very, very heavy tax, will now be the decision of a mere cabinet secretary with no checks and balances. If anything, it creates multiple funds against the ongoing government processes for reducing state-owned institutions, corporations.
They have also expressed concerns that the Act requires overburdened Kenyans in the informal sector to pay an upfront annual contribution and even offering loans if one cannot pay for healthcare.
We are likely to get less, whether we are the informal sector, because you must pay upfront for a whole year, and or they throw in a package that if you cannot pay, we will give you a loan. What is wrong with this government and loans?
Despite the primary fund and the chronic fund being taxpayers' money, you cannot access these funds if you're not contributing. You cannot access these funds if you are in the informal sector and you're unable to pay.
They are not clear. What parameters will be used to determine who is supposed to pay 300? What parameters are going to be used to determine who is vulnerable member of the society?
They insist that the government should have focused on addressing issues bedeviling NHIF instead of creating another fund. According to them, the new law is set to triple mandatory statutory deductions from 1,700 shillings to 5,000 shillings, resulting in each member contributing 8,500 shillings per month or 102,000 shillings annually without assured access to care. This follows President William Ruto's signing of 4 UHC bills into law in October, which includes the Primary Healthcare Bill, Facility Improvement Financing Bill, Digital Health Bill, and the Social Health Insurance Bill. Harriet Chimea, K24.